If you've tried anxiety medication and it didn't work, or it made you feel worse, more anxious, numb, foggy, disconnected, I'm going to say something that might be a relief. You're not the problem, but your treatment plan might be. I'm a psychiatric nurse practitioner, and I work with a lot of patients who feel like nothing works. I have tried everything. Maybe it's just how I am. And usually, they've been given the wrong diagnosis, the wrong medication class, and no real work on the nervous system. So today, I'm going to break down why anxiety meds won't work for some people, what's actually going on underneath, and what I do differently in my practice. So first, let's talk about the wrong diagnosis. Here's the first issue. We're calling everything anxiety when it's not all the same. I'll give you a real pattern I see all the time. A patient comes in with constant anxiety, nausea, poor sleep, racing thoughts, irritability, and they get labeled generalized anxiety, and they get an SSRI. But what's actually going on underneath? Possibility 1, trauma-driven hyperarousal. Their nervous system is stuck in fight-flight, not worry, but survival mode. Possibility 2, hormone-driven anxiety. Progesterone drops, estrogen fluctuates, perimenopause, anxiety spikes that meds don't fix. Possibility number 3 is OCD. Not just worry, but intrusive thoughts, mental loops, what if spirals. SSRIs can help, but you need a different dose and strategy. Possibility 4, bipolar spectrum, and this one matters a lot. If someone has periods of high energy, decreased need for sleep, impulsivity, and you give an SSRI, you can actually make anxiety worse. Now let's talk about the wrong medication class. Even if the diagnosis is close, the medication still might be wrong. If someone with high physical anxiety, like racing heart, shaking, nausea, adrenaline spikes, gets an SSRI alone, but their issue is body-based, they might do better with propranolol for physical symptoms, Buspar for baseline anxiety, or calming the nervous system first. Another pattern I see, someone says, I feel anxious, but also flat, tired, and unmotivated, and they're given higher and higher doses of an SSRI, they can get more numb. They might need dopamine support, mood stabilization, addressing inflammation, sleep, or hormones. Medication has to match the pattern, not just the label. So let's talk about no nervous system work. This is the biggest one, and honestly, it's why a lot of treatment fails. Because anxiety is not just in your thoughts, it can be in your body. If your nervous system is constantly activated, no medication is going to fully fix that. Therapy alone probably won't either. You have to address regulation, safety, physiological calm. What I see in sessions are patients who are always on edge, scanning, easily triggered, overwhelmed by small things. That's not just thinking too much. That's a dysregulated nervous system. And what actually helps, breath work done correctly, not just deep breathing, somatic work, reducing overstimulation, sleep regulation, lowering inflammation, and yes, sometimes medication. But that's not the whole solution. Let's talk about integrative root cause. This is where my approach is different. I don't just ask, what medication do you need? I ask, what's driving this? Because anxiety can come from thyroid issues, low iron, low vitamin D or B12, gut dysfunction, hormone imbalance, chronic stress load. If you don't look at that, you are just managing symptoms. For example, a patient with anxiety, brain fog, fatigue, if they get labeled depressed or anxious, but labs show low ferritin, vitamin D, thyroid dysfunction, that's not just psychiatric, that's the whole body. Next, let's talk about medication. Real talk. Now, let me be clear. I do prescribe medication, and it can be incredibly helpful. But I use it as a tool, a support, not the entire plan. What I tell patients is we're not trying to numb you, shut you down, make you feel like you're on something. We are trying to lower the intensity so you can think clearly and do the deeper work.